Hello, my name is Sten Ekberg, and I have a patient here, Lisa, and I just wanted to ask her a few questions to help people understand more what chiropractic can do. So, Lisa, tell us what's been going on with you and why you came to see us.
I sought out Dr. Ekberg because I'm pregnant and I've been exposed to chiropractic most of my life, ebbs and flows, and I hadn't been seeing anybody recently. So I had a lot of discomfort from being pregnant and knew that it was time to definitely regain more consistent chiropractic care. And after reading the brochures and just kind of checking out a little bit, I felt that there was a different approach here that would be more effective while I'm pregnant. Not just a typical approach. Like I said, I've been exposed to this for most of my life, so I guess you could say more old school, just being cracked all the time, versus the education that you provide of understanding how the body works, how the brain works, and benefits from chiropractic, and then the methods that you've used thus far that are non-invasive have also been the reasons that I found you guys.
Excellent, excellent. And I know that there's a lot of people who are concerned with the force applied by some chiropractors. So can you help people a little bit on that?
Absolutely. There's none of that, I guess, unless you want it. So Dr. Ekberg's been able to adjust me standing up or lying on my side. I don't know the appropriate name, with a little...
Arthrostim, it's an adjusting tool.
Adjusting tool that helps. What I like about it is that I feel that each adjustment is tailored to what I'm feeling that day or what's going on with my body. And you're able to pinpoint each spot rather than just being adjusted the exact same way, which I pretty much experienced most of my life with other chiropractors. Once they assessed you, that I would just get adjusted in the same manner each time. So this time, just having the tool to help pinpoint each spot on my body, I feel like is more personally tailored. And being pregnant, it's constantly changing, so I really appreciate that.
Good, good. And we also want people to understand that it's not about the pain, it's about overall function in the body. And that function is executed and handled by the brain. And what interferes with that, what gets us out of whack, is all sorts of stress. So during pregnancy, a lot of people think that, well, I'll wait till I'm done with my pregnancy and then I'll come in and get adjusted. Well, it's the exact opposite way. It's the other way around. That it's during pregnancy, it's extra important because if you can reduce the stress, then that helps the baby as well. So, anything else that you want to add that you think people should know?
Like I said, I've kind of been exposed most of my life to the chiropractic world, but I just really appreciate the approach of education here, and I've learned more in a few weeks of the talks and just each session asking questions and understanding how the body works and how it should be working and how chiropractic affects that, and it just helps build the value of the investment of coming to chiropractic and making it a lifelong habit. So I'm very happy to be doing it for myself, but also my new person growing inside, and understanding that when the little one is born, that you can start, within their first week and help recover from the stresses of childbirth and what babies go through. So I value that as well for my child. So I'm just happy to have the ongoing education, holistic view and understanding everything from a scientific level. It's been very appreciated.
Wonderful. Well, we're glad to have you.
Thank you.
Thanks
Glad
so
to be
much
here.
for sharing.
Thank you.